liver a natural detox mechanism from your blood is the liver taking your bile or making bile and then taking the bilirubin out of your blood and helping to detoxify it. Hey, I'm Dr. A. Welcome to the YouTube channel. On this channel, I answer lots of patient questions or questions that people write in, etc. So today's question is, what are symptoms of fatty liver? So we've come up with a list of 7 of the most common symptoms of fatty liver. And of course, there's many others, but we'll focus on the big 7. So first off, fatty liver. So it sounds like if there's fatty liver, there would be non-fatty liver, right? Well, the liver does have fat cells in it. So it's not that there's no fat in your liver, but the liver has a multi-tiered ability to help you detoxify in your body, help to process certain chemicals so they can be used elsewhere, process things so they can be eliminated, etc. The liver has a very sort of elegant structure to it in order to be able to do all of this. And so one of the things that happens is that structure, like other places in your body, certainly has a vascular. It has blood vessels going in, blood vessels going out. It has lymphatics draining the extracellular spaces. It's got specific types of cells. Some are general hepatocytes for metabolism. Some are immune cells that live along there and do immune functions. And then there's other specific cells as well. And in amongst there are some fat cells. Now, when your liver is humming along at normal pace and the junk that's coming in is processed and either removed or moved on to another place, the liver kind of maintains its architecture like I just described. When you start to build up more junk coming in than you can get rid of, then you wind up first having that junk settle in the hepatocytes and the immune cells. And then a lot of times for storage, the body will move things over to fat cells. So if I always have more junk coming in than I can get rid of, then I'm going to have an increase in fat in the liver to hold all this junk. And then I'm going to eventually develop what we call fatty liver. And there are different types of fatty liver disease we'll talk about in other content. But the bottom line is, through whatever way you got it, you got more junk coming in, more stressors on the liver than it can deal with and push out the other side. So I want to start out with the first of our 7 things, which is something you might not think of right off the bat, but it'd be loss of appetite. So you see this a lot in people with end-stage liver disease, but also earlier liver disease where they just are kind of developing a chronic illness due to their chronic liver problems, and that is that their appetite actually decreases. There's a number of reasons for that, but some of it is that if you think about your liver doing all of this extra work, and your liver is also involved partially in digestion, there's a lot of feedback between the digestive organs and the liver because they work together. You can have a feedback of some of the digestive hormones, etc., that will tell you, let's not eat right now, and then it'll go to let's not eat very much at all. Another is abdominal pain. Now, your liver lives in the upper right portion of your abdomen, right underneath your rib cage. And if you look, at a drawing, an anatomy drawing or something, it actually curves up and goes right along the diaphragm. So there is a meeting of the diaphragm where the lung comes down, and then the diaphragm's other side where the liver comes into it. They're right next to each other. So it's sort of above your ribs in the lower right portion of your chest, and then down into the abdomen. It's a big organ. It goes over to about halfway and then comes out, and then you have right below that and in back your biliary tract and your gallbladder. So pain can be from your gallbladder, your biliary tract, or just congestion in your liver, but it tends to be either in the middle to the right side or the upper right side of your abdomen. And if it gets real bad or your gallbladder's involved, it can extend to your right shoulder. That's a nerve reflex thing related to the lack of desire to eat, etc. A lot of times earlier than the lack of desire to eat is going to be nausea and vomiting. So people will develop more of a chronic nausea state. And then they might even start to vomit more frequently or or they'll eat and vomit, that sort of thing. Usually later in the game, but this can happen, is jaundice or a yellowing of the skin and the whites of your eyes. And this comes from the fact that the liver, a natural detox mechanism from your blood, is the liver taking your bile or making bile and then taking the bilirubin out of your blood and helping to detoxify it. Some of the remnants of that go into your bile. And bile, if you ever look at a picture of it online, is this real fluorescent kind of yellowish green color. Well, if my liver is slowed down being able to do that, what happens is that the bilirubin in my blood starts to rise, and then the plasma part of my blood, which usually is sort of a real light, almost clear kind of straw color, it will start to get more and more greenish yellow. And then what happens is on the lighter parts, maybe palms of the hands, it starts, as I said, the white part, the sclera on your eye, they will start to look more and more yellow. And then if you get a really extreme jaundice, it's actually more of a fluorescent yellowish green, which is very unusual, and really that's more end stage. But jaundice happens. Fatigue. Why would my liver being dysfunctional give me fatigue? Well, there's many reasons actually, but one of the big reasons is you're not eliminating metabolic and other toxins from your body, and so your body is loaded down with a lot of extra toxic material, etc., and your cells actually can become mildly poisoned or greatly poisoned by that, and they'll slow down. Related to fatigue can be overall weakness, and that can be very important to keep track of in people who are having liver problems, etc. A lot of times if the liver does improve, the overall weakness will actually get better, the fatigue will get better, etc. And then lastly, so we talked about abdominal pain from fatty liver. The other thing is direct liver pain. And so on a physical exam, your doctor, they'll poke around and they'll do percussion and all this. They may actually palpate along your liver, and your liver can actually get tender when it's very backed up or you have fatty liver developed, etc. All right, I hope that answers the question. We've done some other content about liver function and fatty liver and treatments and those things. I'm Dr. A. Thank you for listening to the channel. Really appreciate all you subscribers. If you haven't subscribed, do so if you want to. Like, share, subscribe. Let your friends know. We answer questions here, and I will see you guys on the next video. Thanks.